My name is Alight and I'm going to be performing a skill video for oxygen administration. I have my three gloves right here, my glove, and I have my laser cannula. It's open because I just use it to practice. And I have my oxygen rebreather. Alright, Mr. Sam, good morning. I'm going to be your nurse today. I'm going to be administering oxygen for you, and I'm going to provide privacy, perform, and hygiene. Can I confirm your name and date of birth? Alright, Mr. Sam, your oxygen is pretty low, and your doctor wants us to provide administered oxygen for you. Okay. So I'm going to be administering your oxygen through the nasal cannula. I'm going to put this nasal cannula in your nose. So the nasal cannula, I'm going to connect it to the oxygen tank. I'm going to ensure it's the oxygen tank. Okay. It's going to snuggle into your nose. Is that okay for you? I hope it's not too tight. Do you feel comfortable with that? Okay. So I'm going to be administering 4 liters of oxygen. For nasal cannula, it's from 1 to 6 liters of oxygen, but the doctor prescribed for 4 oxygen. So it doesn't need an humidifier since it's less than 4 liters. Alright, Mr. Sam, if you need to go to the restroom or you need to take a walk, please call the call lights and I'll be here to assist you, okay? Alright, I'm going to ensure I check on the patient every 2 hours for tissue integrity. So I'm going to come back because the patient's oxygen is too low and the doctor prescribed for 11 liters of oxygen. Alright, Mr. Sam, your oxygen is still pretty low. I'm going to take off your nasal cannula, okay? And I'm going to trash this. So for 11 liters of oxygen, I'm going to be using the non-rebreather mask. So for the non-rebreather mask, their oxygen can be from 10 to 15, but the prescribed oxygen it's 11 liters. So I'm going to connect this to the oxygen tank. And I will ensure that there is air inside this bag. So Mr. Sam, I'm going to place this non-rebreather mask for your oxygen, okay? Is that okay? Is that comfortable? Okay, this is used to tighten the face mask. Okay, so I'm going to put this padding to ensure skin integrity. Put one on the nose. And one at the ear. Sorry. Okay. another one at the other side. Okay, my patient is breathing. Alright, sir, as I said earlier on, if you need to take any walk or go to the restroom, please use the call lights and we can come to assist you with the oxygen, okay? And after that, I'm going to make sure I come back every 2 hours to check on my patient's skin integrity and also to avoid equipment pressure also. So my patient's oxygen increased and is doing better with his oxygen. Now I'm going to take off the oxygen. Alright, Mr. Sam, I'm going to take off your oxygen. Now your oxygen is doing better now. It's a little bit high, okay? So I'm going to take this off. Alright, Mr. Sam, if you need anything, please call the call lights. Are you okay? Are you comfortable? Alright, if you need anything, call the call lights. I'll be here to assist you, okay? I'm going to trash all this. Remove my glove. Perform hand hygiene. And I'm going to document my findings and document the oxygen level or what I just did.